Dr. Adam Childers again with another Powell Valley update regarding COVID. I've been asked to visit with you in regards to two questions, so let's start with question number one. That question is, should I get retested after I've been diagnosed with COVID? And the answer is a bit of a mixed answer. The short answer is, if you've had COVID less than 3 months ago, do not retest. The testing that we have is quite sensitive and is capable of picking up tiny bits of residual virus which are no longer active for upwards of 3 months. So you will continue to test positive for 90 days. I know sometimes employers get nervous, or others thinking, well, if I don't have a negative test, am I safe to go back to work? And the answer is yes, you are. Other tests that we have in different types of scenarios have similar sensitivities. So you can trust that if your physicians released you to go back to work, then you're safe. And the general time is 10 to 14 days after symptom onset, and there's some variability depending on what you have happening. The second question that's come to my attention recently is questions regarding rationing of care. I know that's always a scary concept when we hear that, especially when we hear that it's going on. I would like to reassure you that at this time PVHC is not rationing care. We are dealing with COVID patients. Yes, we have some in-house. We are also taking care of other patients, and I can reassure you that we're using all the appropriate safety measures so that non-COVID patients can be treated and taken care of safely, as well as any patient with COVID can be treated safely. This is part of a large joint effort. All of the hospitals within the basin, as well as Billings Clinic and St. Vincent's, are working closely with one another to provide services and help each other give the best rate medical care possible to everybody for all of our needs. Again, I want to reassure people that we are not rationing care at PVHC, nor is there any rationing of care going on in the basin at this time that I have been informed of. However, if you continue to have questions, I would encourage you to call our COVID hotline, and that information will once again be placed in this video as well as on our Facebook site. Thank you for your time, and I hope you found this helpful.